and do some forms of surgery for these people.
Okay.
And all these are available.
Thank you so much. It's still Medical Minds, Dr. Anderbat on the show with me, Teacher Zita. Before we go for a break, I would like to remind you again that our numbers are 0786-050-762 in case you want to be part of this show. It's still Medical Minds. Doctor, let's look at this illustration. Yes. What exactly is this?
Yeah, so this is a very good illustration, and for the reproductive hormones especially. And I think I need to just explain it a bit. Now, the most important reproductive hormones are those which come from the ovary for the woman.
This is for a female?
Yeah, this is the illustration for a female.
Okay.
So in the ovary produces hormones, it produces eggs.
Okay.
Now, the hormones which the ovary produces are the estrogens and the progesterones. These are the two major hormones.
Okay.
And then these are being produced under the control of some other hormones from the brain, which we call here the FSH and the LH. These are the hormones which control these ones here. So what happens from the beginning of the period, that is the time when the ovary starts producing the hormone estrogen. And that's the time when the egg for that month is beginning to grow. So this goes on, and around the 14th day, it reaches the peak. So here the period stops somewhere in the middle, and then this estrogen is helping the lining to build up. And somewhere here, the egg is released, and after the egg is released, the estrogen goes down a bit and the progesterone takes up.
Is that the variation we're talking about?
Yes, this is the type of variation we are talking about. So these things are very coordinated. And if you look up here, these are the hormones which control this. So their levels also relate to this. This is the point of peak, where egg is released, then where there's a changeover from estrogen to progesterone occurring. So this must be balanced for somebody to be able to produce quality eggs, to be able to prepare the womb enough to receive the fertilized egg.
Okay.
Yeah, so this is very, very key. So like PCOS, what we talked about, the events go and they stop around here.
Okay.
So when it reaches here, everything goes flat. Now that means anything beyond here is lost. That means there will be no release of eggs, there will be no pregnancy, and the next period misses. So this is, and people find and describe that as imbalance of hormone.
Okay.
So what I was emphasizing is that when there is a presentation of an imbalanced hormone, the clinician should be in position to know that depending on the pattern of this here, this is PCOS. And it is the PCOS that you treat. You don't just treat the hormone. The hormone response will be in response to your treatment of the PCOS.
Okay.
Yes.
Thank you so much, Doctor, for that illustration. Let's talk about weight.
Yes.
Does weight, for example, someone who is overweight?
Yeah.
Okay. I'm going to ask you something about weight, but we're still going for a brief break. We shall be back shortly. It's still Medical Minds. Please prepare your questions and inquiries on 0786-050-762. Stay with us.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health. Introducing Bethany TV. the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV, for health. Bethany TV, for health. Are you ready for this good news? You can now watch Bethany TV on Your TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV, for health.
Christmas for me was waking up early in the morning, preparing for church, putting on our big, white, beautiful dresses, running to church, meeting the loved ones, and also having very, very delicious meals every Christmas. That is the time where we eat a lot of food, drink so much soda, so much juice, having a lot of fun, having a lot of warmth in the house. And from me to you, I wish you a very Merry Christmas and a Happy New Year. I'm Joanna Mwonge, the Assistant Human Resource Manager at Bethany Women and Family Hospital. Keep watching Bethany TV. Thank you.
Bethany TV, for health.
Thanks so much for staying with us. This is still Medical Mind and it's Bethany TV. We are together with Dr. Underbart and we're talking about hormones. We're looking at hormonal balance. We're looking at everything about hormones. I would like to remind you that our lines are open 0786050762. Just in case you want to be part of the show, you can send us your messages there on WhatsApp, or you can give us some calls in a few minutes and Doctor will be right away ready to give you back your answer. Please keep watching Bethany TV so that you don't miss out on Bethany Santa Omugabi. You can easily win yourself a gift so long as you answer the questions that he has given you. Welcome back to the show. It's still Medical Minds. Doctor, before we went for the break, we were talking about weight. Does weight affect hormones in every human being? Let's talk about overweight. Yes, overweight. And a friend of mine was telling me that because of his weight, he has failed to produce any child. How is that related?
Yeah, so weight is an important factor, especially in relation to hormones.
Okay.
Yes. Weight and hormones act to and fro. Hormones in unbalanced state can give you overweight,
okay,
and an overweight could make your hormone go in an unbalanced state. So it is a two-way traffic, and at the end of it all, especially in terms of the ability to conceive, it has a negative effect. What we know, overweight has a negative effect. Of course, underweight as well has negative effect in the quality of the sperms and the eggs. It increases the risk of miscarriages.
That is in women, overweight?
Yes, overweight in women and also in men. Now the current evidence is that actually overweight in the man also affects his sperms as well, his ability to function well as a man and to have sexual activity, and also the quality of his sperms and its ability to cause pregnancy and even the pregnancy to sustain itself, because now the weight, as we understand more and more the effect of weight, we actually realize that it's a very huge disorder, which has multiple facets of effect on the body. And so we know now in terms of reproduction, as you uncover these things, it gets even more scary. But the good news is, when it is controlled, things get easier. Yes.
Okay. Thank you so much, Doctor. Let's look at this illustration.
Yes.
Yes. What is it all about?
Yeah, so in this illustration, we are really showing the relationship between the different hormones, and on this side for the men, and this side is for the women. Okay. Again, the major hormones are those which are produced by the ovaries, the primary hormones for the women, and there are those which are produced by the testes for the man. And in both cases, these hormones which are produced by the ovaries and the testes are under the control of some other hormones produced by the part of the brain, which means it provides an oversight. The brain provides an oversight on reproductive function. So these arrows indicate the interplay between the different hormones. Yeah, so we shall use this to explain some of the things, some of the conditions.
Thank you so much, Doctor.
Thank you.
I think we have a message already coming in from one of our followers before we go so far. He's saying, "Good evening, Doctor. I am Esther from Nakawa. I always get periods which come more than days. More than normal days. Yes, normal day periods. What are they supposed to be?"
Okay. So a normal period has certain characteristics. One of the key characteristics is the regularity with which the period comes, but also another key characteristic is how long the period lasts.
Okay.
Normal periods last between 2 to 5 days maximum, an average of 3 days. Now, if period lasts for more than 5 days, then there could be something wrong. And in such a case, it is an issue either of the hormones, but often it's an issue with the womb. This is how the period turns out to be heavy, for example, in somebody who has uterine fibroids, or in somebody who has some condition called adenomyosis. So her hormones and her womb need to be evaluated to understand the primary cause of this problem.
Okay.
Yeah.
Thank you so much. Esther, I think you've got the answer from Doctor. This is Irene from Kasubish saying thank you for the show. I gave birth to the baby who is now 6 months, but I got my menstruation for only 1 month. Hormones the cause of this? I'm really scared.
Yes, okay. This is a very nice question. Now, pregnancy is one of the conditions which changes the pattern of the hormones in the body. Then after giving birth, another state of hormones, which we didn't show here, comes in. One of the key hormones there, which is related to breastfeeding, is called prolactin.
Okay.
Now, when a woman is breastfeeding, she has very high levels of this hormone called prolactin. You can understand, pro means for, lactin is milk. It's a milk supporting and producing hormone.
Okay.
Now, in the first few months after giving birth, if the woman is breastfeeding very regularly, this hormone level is very high.
Okay.
And because it is high, it disrupts the normal coordination of the reproductive hormones. And at first, the person does not get the period.
Okay.
Then later they start getting periods, but sometimes they miss. Maybe their periods are light. Now, that is the reason why we use breastfeeding as a means of family planning.
Okay.
Yes, because the breastfeeding process, which makes the body to produce high levels of this hormone, such that it interferes with normal return of reproduction function. So the eggs will not be released, the womb and will not be ready to receive a pregnancy, so you are safe under the cover of breastfeeding.
Thank you so much, Irene. I think you've got your answer. Please feel free, don't worry. Those are hormones that are being produced because you're breastfeeding. You're very safe, please. There is no cause of alarm there. Doctor,
but then also for Irene, the return of periods is a sign that she could get pregnant anytime.
Anytime.
Yeah, so this is about the time she should consider. If she's not willing, I would propose that she sees a doctor and discuss about family planning. Yes, this is about the time.
Okay.
Yes.
Thank you so much, Irene from Kasubi. I think you're following us. We promised to get back to the questions of last week.
Yes.
Towards the end of the show, we have a few minutes to go. I think I would start. With. This is someone 4B. He's saying, "Hello, doctor. I'm 4B from Namataba. My question is, why is it that obesity is very associated with infertility?" I think you answered that almost.
Yes. I think we discussed that. It is through the hormones.
Yes. Thank you so much.
And also the womb, by the way, of people who are obese are unfavorable to pregnancy.
Okay.
Yes.
Doctor, may I ask you something small about that? What causes the womb to be very unfavorable for conception for someone who is very obese?
Yeah.
Are there some external bodies that grow or develop in there, or?
No. Often, it's you see the hormones, as we illustrated. The important hormones are produced in organs. For example, the ovary. Others are produced by the brain. Now, these hormones have to travel through the blood vessel and eventually be delivered in the right tissues.
Okay.
Like for the ones of the brain, they have to be delivered to the ovary.
Okay.
Yeah. Now, when they are in the ovary, when they are delivered in the ovary, that's when they take effect. But in somebody who is obese, the distribution of these hormones is affected. So you find that causes either the hormones to be too low in the areas where they're supposed to act, and so you find their functions are low as well. Okay. Yes, but also the obesity per se, it seems to produce some abnormal hormones. We commonly call, there's one called leptin. It's produced by fat. Okay. And when that is produced and the level goes beyond, it behaves like the other hormone, which causes sort of a state of family planning in women who are breastfeeding. Yes. Okay. So through hormones, really, that is what we know.
Thank you so much.
Yep.
We have one who said, "Thanks for the program. Can I conceive while I have fibroids?" This is Carol.
Yeah. So fibroids, first of all, these are abnormal growths within the muscle walls of the womb. Now, that is where a baby grows. A baby grows inside the cavity of the womb. Now, in most cases, most fibroids, except those which are really, really big and hanging inside, most of them will not stop you from conceiving, but they can cause miscarriage. And so the decision on whether you want to go ahead and have a baby before a fibroid is managed or not should be taken under the guidance of a doctor. The doctor should be able to use his technical knowledge to tell you that, from what I know, this type of fibroid may not affect you. But in case, or may. So he should be able to guide you in that one. There are others which are obvious that it will not have effect. There are others which are obvious they may have effect, high chance. There are those which are in borderline. So you discuss with the doctor and see whether your fibroids have issues or not.
Thank you so much, Carol. I think you've got it. First, seek medical guidance from the doctor. This is Rita from Entebbe. She's saying, "Doctor, I've been giving birth only girls. I've reached a time and allowed my husband to go out at least and get a baby boy." This is something we discussed in the first segment with another woman. But still, this lady gave birth to a girl.
Yes, so it comes to the same science. And we said earlier that, the sex of a baby is determined by the type of sperm the man produces. There's the sperm which will lead to a boy. There's sperm which will lead to a girl. The one which we usually label X is the one for girls. The one labeled Y is for the boys. So it is determined by the man. As you can see, the man went out and still the same thing. Yes. So the issue here is, why do some men produce particular sex and not the others? This has been a very big question in science. We do know that there are certain things which do influence that a bit. Some researchers show that they are really strong, others show that no, it's not true. For example, the timing of mating has some influence, because what we know is that the behavior of the sperms which eventually lead to boys, they differ slightly from those which lead to girls. The ones which lead to boys, they move faster. So if you put them in a crowd, they will probably be in front.
A little faster.
Yes, but they don't last for long. The one for girls move a little bit slower. slowly,
But they are stronger.
they last for a longer period of time. So, for example, if a woman meets with a man at a time when she already has ovulated, that is, the egg is already released and it's already there. It's like a target waiting. By logic, you will imagine that the one of the boy will meet first, will reach there first, as you can imagine. Yes, so that's why meeting after ovulation has occurred increases the chance of getting a
baby boy.
Yes.
I think we need time to educate everybody
And
about that.
it is a chance, not like absolute, but that is the truth.
Okay.
And then on the other side, meeting before ovulation has a higher chance of getting a girl, because by the time the egg comes, those of the boy would have vanished. They will be tired, and the ones of the girl will be the one.
Okay.
So this is really the science behind that. But again, I want to emphasize it is the chance.
It is a chance.
It is a
really.
chance. Yeah.
Can there be some treatment
to enhance
to balance the hormones? Yes, one for the boy, one for the girl.
Unfortunately, at that level, no. But through IVF, we are able to do what we call sex selection. At some point, we will discuss how that is done. Yes.
Okay.
So we will be able to explain. And in the IVF program, what we call IVF with sex selection program, we are able to determine who gets which sex.
Okay.
It's a little costly, but it's something, and it's absolutely like 100% that the sex will be that. Yes.
Thank
so
you
that's
so
how
much.
far science has gone.
It's okay. It's
Yep.
still Medical Minds, and it's Bethany TV. Dr. Ndabat is trying to give us answers to all our questions, especially those who asked all these questions last week and we were unable to attend to you. Rita, I think you've got your answer. Please try to also seek some medical guidance from professionals. You never know, you can have your chance. Doctor, we still have another question that this, I think she didn't, gift from Mukono said she treated PID, but it's now 5 months. Still, she has failed to conceive. What could it be?
Yeah, so PID is a pelvic inflammatory disease. It's usually a form of infection in the pelvis, and that's where the reproductive organs are. One of those of worry is the tube. So infections may be healed, but the scarring around the tube may continue. So if the tube is involved in a scar and it's blocked, chances are that conception will be disturbed. Okay. So delaying to conceive after treatment of PID may be an indication there could be issue with the tube, and so she needs an evaluation of all those.
Okay.
Yes.
I think this is almost all the same. She's still saying, hi, I'm Faith, I did HSG and it was normal, and also my hormones were normal, but what could be the problem with me? I failed to conceive. It's 2.5 years. I think it's still related to...
it's a little bit different, that question,
different?
and it's a very important question because here, to start with, to get a pregnancy, it is a action of both sides, the man and the woman. About 4 things are needed. 1, you need eggs from the woman. From the man, you need sperms, because the sperm and the egg meet to make a baby. The third thing is the tube, because they meet in the tube. The sperm and the egg meet in the tube. Okay. So the tube must be okay. This is the third thing. Eventually, the baby grows in the womb, so the womb must be fine. So, in the investigation, they have evaluated the hormones, which are said to be normal. Probably that means the eggs are fine. She's ovulating, but also she has tested her tubes. Her tubes are okay. So we need to know. She needs to know about the womb, and we need to know about the man. And it is important for people to know that actually, in 30% of our cases, the problem we see is in the man. The problem is in the man. Yes, so she needs to go further and have further evaluation of those factors, like the man's side of the sperm, and then also to evaluate her womb. But she needs the guidance of a doctor.
Thinking it's her.
Yes, when it's the man. Yeah.
Because oftentimes most men don't take that responsibility. I think it is the mother who is infertile.
And it's not correct, because even then, people need to approach this issue of fertility with an open mind, because it could be either And people need to know that fertility is a function of both. But also, the available tests sometimes show that everything is normal. Even on the man's side, it is still normal, and still you can't conceive.
Sure.
There are those cases which are classified as unexplained. The good news is that in most of them, management is a bit simple, and people can conceive within a certain period of time.
Thank you so much, Doctor.
Yep.
Doctor, we talked about estrogen
Yep.
some minutes back, and we had not illustrated it. If we look keenly at this illustration,
so I in this illustration here, we want to emphasize the importance of the issue in terms of the reproductive life of the woman.
Okay.
Yes, here we are giving an illustration of how the estrogen levels vary as the woman ages.
Okay.
Yes. For example, when she's just around 20 years, you find the estrogen levels probably can give an illustration around here. It keeps on going up. Around 30, it's really a lot of it. You know, at every stage of the cycle, you find the estrogen shoots higher up. Then that starts dropping, you know.
So the more you age,
the more you grow, because from around, it could be probably a little bit earlier, yes, but there's a time when the estrogens are at the peak in terms of if you test the estrogen at any stage in the cycle, yes. But then beyond 40, 50, this could be shifted in our population to a little bit earlier. And by 70 and 80, you are really having very little of the estrogen. And that's why the periods disappear, and that's why the woman gets into menopause.
okay,
Yes.
because of the levels of the
Of
estrogen
the
dropping
estrogen.
down completely.
Yes, yes.
Thank you so much, Doctor, for that beautiful illustration. You can now be part of the show by dialing 0786 050 762. It's Bethany TV, and we're still talking about hormones in both men and women. We have another question here, Doctor, we didn't attend to. He's saying, good evening, Doctor. I had a laparoscopic surgery in August due to cyst that was in my right endometrium. But since then, the fallopian tube hurt so much, especially towards and within my periods. Doctor, kindly advise. She's Susan.
Yeah, so this Susan had a laparoscopic surgery for a cyst, which I think must be maybe in an ovary.
Okay.
Yeah, cysts are swellings in the ovary. Now, the cysts, first of all, the condition which causes the cyst may be having an additional complication.
Okay.
For example, endometriosis is one of the causes of cysts in the ovary. It will have other complications related, maybe like to the tubes, or the surgery itself for this cyst could have had a complication as well, or its recovery could have had an issue. So she needs a further evaluation, especially of her tubes, but also of her hormones as well, because sometimes when they are removing the cyst, often actually when you are removing a cyst from the ovary, you lose some ovarian tissue, and if you are only relying on one ovary, and then you could go into a situation where your eggs are not enough and you get issues with conceiving.
Okay.
So she needs evaluation and probably of the hormones and her tubes. Yep.
Thank you so much, Susan. A doctor was able to explain to you. I think you need to take further steps and seek medical guidance. We have another question coming in from Maria. She's saying, hello doctor, this is Maria. I am a sickler, and sometimes I miss my periods, and I thought it was the drugs I take causing that. Could it be hormonal imbalance or the drugs? Before you answer, doctor, there's someone calling online. Bethany TV, hello. Kale mama, nawe jebaleko. Bakuyitane mama?
Bamita Lilian.
Lilian wanje mama.
Embadde mbuuza kiki ekireetera abantu cramps obaluma nga balagezi baluma.
Ulcers? Cramps. Okay. Kale Lilian neyanziga omusawo agenda kuddamu. Lilian is saying, why do others have cramps and other women don't experience that?
Okay. Yeah, so cramps are some form of painful period. It's a form of painful period, and there are different causes of that.
Okay.
Sometimes it's because of some mass within the womb. Maybe a fibroid is hanging there and the womb is trying to squeeze it out, and then that causes cramps. In some people, the reason is related to some local hormones within the ovary, within the womb. We call them prostaglandins. If their levels are too high in some people, then they get painful periods as well.
Okay, sorry about that. Lillian, I think you've heard whatever doctor said. We have another call online. Caller, hello. Hello. Wanje Semwanga, okubiddewo Semo. Kachindu. Kachiri wanje Sebo. Oli kumpi nnyo ne TV yo soko sembereko ko katonda tukuwira bulungi. Hello, wanje Sebo, tetukuwira bulungi. Okay.
How can I do? What can I do to get libido?
To get libido. Okay, thank you so much. Thanks so much for your call. He's 65 years old.
Yes.
And he's inquiring how he can get libido.
Yeah.
Yes.
So that means he's having challenges with sexual desire and sexual performance. Now, first of all, he can be helped. That's called erectile dysfunction. There are some medications which can be given to support him.
Okay.
But usually what is happening is some condition called androgen deficiency related to age in men, something called Adams.
Okay.
In this condition, with age, we've described that the hormone production ability of the testes goes down. Now, you can improve that by your lifestyle, reduce stress, make yourself happy, that improves the hormone production, the testosterone production. But also eat healthy, eat a lot of vegetables and the nuts, and those help as well. But in case all this is not functioning well, you need some medication, you need some medical support. Yeah.
Okay, thank you so much. Someone else on the line, Medical Minds, hello.
This is Barbara.
This is?
Barbara.
Yes, Barbara. Where are you calling from?
From Melbourne.
Yes, please.
When I get my period, that's very normal, like the normal period, because nina condition here ya pickle.
Okay.
But sometimes I get normal period. If I get when missing like when period,
Okay. Thank you so much, Barbara. Okay. Barbara is saying she at times take long in periods. At times she misses periods, and when she misses the periods, they come when they're normal and she doesn't get cramps and pain. But if she doesn't miss, at times the period pains and the cramps are really so painful. What could be causing that?
If I can
she has the PCOS. I think she said she has PCOS. Yes, that condition.
Yes. So she has PCOS. Now that pattern of disturbed period is typical of PCOS. So you find the person goes for a long period of time without their periods. When the periods come, they may take a longer time or they may take shorter time, but often they are crampy. Sometimes they are not crampy, but missing period is an indication of PCOS. Now, as we said earlier, it is very important to manage that condition, PCOS itself, and the period should get back to shape. And there are ways in which you manage. One of the simplest is to manage your weight. It may be a difficult task, but you can work with somebody who helps you to manage your weight.
Okay.
In both using diet and using exercise.
Okay.
And then if this is not doing quite well, you also have to add some medications. Now, the challenge with weight management in these conditions, it takes time to have effect.
True.
Yeah,
you have to persist.
You have to persist. There has to be a lot of commitment.
True.
You will not expect your weight to improve within a month. No, it takes time. But if you have the the picture that you want something, you will commit to it.
True.
Weight management is very, very key.
Thank you so much, Doctor. Back to Maria, the sickler.
Oh yeah.
Yeah, she's saying, I miss my periods and I thought it was drugs that I'm taking. Could it be hormonal imbalance or the drugs causing this?
Yeah, so in sickness, there are a number of ways in which the period can get disrupted.
Okay.
Because the sickle cell crisis alone is a stressful attack with a lot of pains and also the thought that you are having sickle cell and you're having complications can put your hormones in an imbalanced state and you end up missing a periods. Yes, so the stress alone related to the condition and the attacks can cause it. But also we know that in sickness, their reserve of the ovaries go down a little faster because in sickness they form tiny blood clots, especially where sickle cell is not properly managed.
Okay.
Those blood clots can block the blood supply to the ovaries, and so you get them losing the ovarian function a little bit early, but it's very unlikely to be the medications.
Thank you.
Unless if she's using those other medications which are toxic to her ovaries, which is very unlikely.
Okay. Thank you so much, Doctor. We are time barred. It's still Medical Minds. Just in case we did answer any of your questions, please feel free to send your messages on that 9 on 0786 050 762. We shall be able to reread and the doctor will be able to get back to you next Sunday in the next show that is coming up. We are about to sign out, but a few things we've learned from this topic is that, one, hormonal imbalances and balances can be managed. Please seek medical help if you have any of the challenges. Two, the doctor talked of living a healthy living. Please do exercises as much as you can. Eat well, manage your stress so that at least you curb down the risk of your hormonal imbalances. And then lastly, we've also learned that in reproduction, it is the male part that plays a bigger part in giving the right sex to the mother, either a boy or a girl. So we can as well take that on, that it is not the women supposed to be blamed. Yes, so doctor, please your last regards to those who are watching you.
Yes. Yes, I especially like the last comment you gave of who determines the sex.
Yes.
Yeah, yes. So, but what I can say is that most of these hormone-related issues, they are manageable, but always it is very important that you, as the person who has the hormone problem, you should engage your doctor to explain to you clearly what the problem is. This blanket diagnosis of hormone imbalance is not going to help so much. So together with your doctor, you should be able to discuss, yes, I have an imbalanced hormone, but what is causing that? Is it my ovaries are not functioning well and they are not producing enough hormones? And why are they not producing enough hormones? Is it something to do with my brain, which part of the brain which is controlling this? So that the path of management becomes clear. And if it requires your participation as a client to work on your weight, then it becomes easier to adhere to it because you know that's the line of path you're going to follow. Yeah, so please educate yourself, read extensively also as yourself. Okay. Yeah. Thanks so much, Doctor. Thanks so much for being with us on Bethan TV. It has been Medical Mind. This is Teacher Zita together with Dr. Anbert. From the team and the entire crew, we wish you a very happy night. Please sleep well. See you next Sunday. Thank you.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV. For health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV, for health.